Okay. All right, my hospice family. I tried to change the orientation and it just did not like that. So this is how we're gonna have to stay for now, okay? I really did try to like change the orientation of the channel, like of the, I want it to be this way, but it did not let me do it. So, all right. But anyhow, my hospice family, come on in, come on in. I'm hoping at least one of us, well, not one, I'm sorry, 10 of us. Okay, that's usually my goal, is to have 10 people on the live with me. Okay, is to have 10 of us. Are we live? I think I am live. Okay. So let's see. We are going to continue to talk about morphine. Okay, we're going to continue talking about morphine. And also we are going to talk specifically regarding to addiction, okay? We're going to talk about morphine, but specifically regarding addiction. That's what I want us to talk about today, okay? And I would like to put the title on so that we could see what it is. But for some reason, I'm not showing, it's not letting me do so. But come on in, guys, come on in. I'm just waiting on at least 10 of us to come in so that we could continue to talk about morphine. This is not morphine, as I mentioned. This is just cranberry juice, okay? But the last video that, we did, I talked about it, okay? I talked specifically about, the morphine. So I want to just continue our conversation. Okay. Let me know, my hospice family. Let me know if you have any questions. Let me know if you have any thoughts. Okay. Let me know what other hospice. Hello, hi. I see my first guest, my first friend. How you doing? How you doing? Say hi as you come in. Please come on in. We are live. Yes, we are live again. I'm going to put the title of the live so that we know what we're going to be talking about. Okay? This is exactly what we're going to be talking about. We'll be sharing about morphine. Hello, everybody. Hello, as you come on in. Please say hi. How you doing? Does he mean mana? Oh my God. I'm just gonna call you Edison. Is that okay? Hi, Edison. I'm doing well. How are you doing? Are you a man or a woman? Male or female? How are you? I'm guessing you might be a man. Hi, Sunu. Say hi, guys. Give me a like. Like this video as you come in, please. Help this channel to grow. Please help this channel to grow. All right, give me a like. We are going to continue on our topic, which is the myths about morphine and addiction. Okay, we are going to be talking about morphine and addiction. My name is Miss Dunsteadler. Okay, my name is Nurse Dunsteadler, and I'm a hospice registered nurse. All right, this channel right here, this channel is for any caregivers. It's for anybody who's currently taking care of a loved one who is dying. You see, anybody who's taking care of a loved one who is terminal ill, that's what this channel is for. Okay. Hi, Guru. Hi, how you doing? Please give me a like as you come in. Say hi. All right. Come on, guys. Come on in. Come on in. I'm getting my notes ready. Okay. We are going to talk about drug addiction today. Drug addiction and being under hospice care. Okay. That's what we are going to talk about. All right. Come on in, guys. in my last video, I'm sure you saw my last video where I had, you know, the syringe, and then we pretended like this was morphine, but this is actually cranberry juice. Okay, that's cranberry juice. I am up north, Edison, from Massachusetts. Have you ever been up north? Where are you from? Let me know, guys. Let me know, my husband's family. Yeah. So this is, the syringe. All right. Well, not really a syringe, but like a vial that we use, and we pretended like this was morphine. So if you have not done so, go ahead and check out my last video. Okay, my last video was when I talked about, you know, the morphine, and I specifically said what morphine is for. Who is watching right now? Who knows what morphine is used for, and who has experience with morphine? Let me know, guys. Let me know, my husband's family. Who among you who's watching right now, okay, who has experience as a caregiver, who has experience with taking care of a loved one? Let me know. I would love to know your experiences, and I would love to know your struggles and your challenges, my husband's family. Let me know your struggles, your challenges, okay, as you take care of a loved one. All right. I am going to, get started talking about addiction, and of course, end of life care, and morphine. Okay. All right. So I have the description of the title, and I also have the title of the video. All right. So we know exactly what we're going to be talking about, which is awesome, awesome, awesome. All right. So, first of all, who knows what who knows what morphine is for? Hi, Zena. How you doing, Zena? Good afternoon. How are you? Come on in. Give me a like, guys. Guys, like this video as you come in. All right. Support as you come in. All right. So let me talk about morphine. All right. Let me talk about morphine and what morphine is and what morphine does. And as you watch the video, let me know if you have had experience with morphine. And thank you for the like. I see I have 1 like so far. Yay. Okay, so morphine, for those of you who don't know about morphine, and for those of you who are not in the health field, morphine, basically, it is a medication that doctors prescribe at the end of life. And most likely, morphine is used when somebody is in pain, okay? When somebody is dying, oftentimes one of the symptoms that they have is pain, you see? So morphine helps with pain. And not only does it help with pain, it also helps with difficulty breathing. You guys, I'm also going to ask you to please subscribe to my channel, okay? Subscribe to this channel. If you have not done so, you could definitely support me, okay? Support by subscribing, all right? We talk about end-of-life care. We help, okay? I'm a hospice nurse, a registered nurse. I am here for the caregivers, okay? Anybody out here who's a caregiver, who knows somebody who's a caregiver, this channel is for you. So please go ahead and subscribe and give me a like. All right, so morphine, not only is morphine for pain, it also helps with difficulty breathing. All right, so these are the 2 things, okay? The 2 factors that, my name is Patty. Hi, Patty. Nice to meet you. Are you a caregiver, Patty? Let me know. All right, guys. Yeah, so morphine helps with difficulty breathing, and it also helps with pain. Okay, so if somebody is having pain when they're dying, if somebody's having difficulty breathing, the doctor will most likely, prescribe morphine. And in my last video, like I said, I did a whole like I showed you guys how to draw it up and things like that. Let me know if you want me to show the same demonstration that I did in the last video. But that being said, one of the main misconceptions, okay, one of the main things that families worry about is Hi, Caesar. Good afternoon. Come on in. Give me a like, subscribe, please. So one of the main things that families worry about is addiction. They often say to me, nurse, is my family going to be addicted to morphine? We don't want my family to be addicted. We don't want mom to be addicted. We don't want dad, my husband, my wife. We don't want, no addiction. Now, it is a very nice question, okay? It's a very good question, and I completely understand. So that's why I'm making this video. So please share it, okay? So that we know the difference between addiction and the difference between being, under hospice care and being at end of life. All right? Now, I want us to know that addiction, okay, addiction is pleasure seeking. You see, when somebody is addicted, they are seeking pleasure, okay? They are doing the drug so that they can get pleasure out of it, all right? Whereas when somebody is dying, when we give you the medication and you are dying, it is because of comfort. It's because the body is slowly shutting down. So when our body is shutting down, the body needs certain medication, you see, to make it feel better. Who understands what I'm talking about? Who understands? Do you have any questions, guys? Please give me a like, subscribe, let me know, okay? So like I said, in hospice, morphine is used to relieve you from suffering. Whereas when somebody is healthy and they take the drug, okay, it is for pleasure. It's to seek pleasure. So keep that in mind when you think about, addiction, when you think about giving somebody who's dying medications. All right, my hospice family? Okay. Now, I want you to know too, is that with regards to addiction, there is such a thing called tolerance level. Because the more the person take the medication, the higher the dosage they would need in order to have the same impact. But whereas when you're under hospice care, your medications are monitored, okay? Your medications are secure. They are monitored by the hospice nurse, okay? By a hospice nurse such as myself, you see? And so there's more control, and it's less likely that somebody's going to, say, overdose, okay, on a medication or take meds, that they're not supposed to. You see my hospice family? You see? You see? And know that when somebody is in pain, when somebody is taking the morphine, it helps them to be able to not only to breathe better, okay, but also it helps you to eat better, to sleep better. I have my notes here. You are able to experience peace rather than panicking. You see, a lot of family members, when their loved ones are in pain, when their loved ones have difficulty breathing, the family member starts to panic. Whereas, the morphine, if it is controlled, if it is given to us when we are dying, that will bring peace to your family. It will also bring peace to you. Because addiction, my family, addiction is when the body does not need the medication. You see? Like I used the example before. Think about it like this. Think about it as, you had knee surgery. If you had knee surgery, okay, if you had knee surgery and your doctor prescribed you oxycodone, your doctor prescribes you oxy, and 3 months down the line, you no longer have the pain from the knee surgery, you see, but yet you continue to take the oxy. So therefore, what do you think is going to happen? Hi, Vanetta. Welcome, welcome. Please give me a like, guys, as you watch this video. Please subscribe, support the channel so much. I love you guys. Thank you. So when you no longer have the pain and you take the medication, that's where addiction comes in. You see, that's when you're going to be addicted. But whereas when we are dying and we take the medication, it's going to go to our pain. It's going to go, to the, it's going to attack the receptors that is causing us pain. Does that make sense, my hospice family? Comment, please. Comment, share. Give me a like, subscribe. Let me know your thoughts. Let me know your experiences with taking care of somebody under hospice care when they're dying. And my hospice family, another thing that I want to share is that too. Not only are families afraid to give morphine because they feel that the medication is going to cause their loved ones to be addicted, but the family also don't want to give morphine because they feel like, oh my God, if I give dad morphine, that means it is the end. Dad is sure going to die tonight. Mom is sure going to die tonight. And I'm here to tell us that is not the case. You see? Because morphine is here for comfort. It's not here to speed up the process. No. As a matter of fact, us hospice staffs, we want you to be with us for as long as possible. You see, we are here to manage your symptoms. We are here to make sure we bring peace to your family members. We bring comfort. We bring dignity. Okay? We bring love and respect to your family members. And so therefore, we definitely do not want you to die, not even a second before you're supposed to. If anything, my hospice family, please listen up. Research has been shown that when somebody's under hospice care, they actually live a lot longer. They live a lot longer. And the reason is because of all of the care and the support that they get. For example, if your mom, has a UTI, say your mom is elderly, like, 80 years old or older, or even, 70, 60, okay? Say your mom has a UTI and your mom is bedbound and it's really hard for you to take her to the hospital. You see? Follow me, please. It's hard for you to take her to the hospital. Therefore, you could have a hospice nurse come to mom, okay? Go to the house, take a urine sample, okay? A hospice nurse, such as myself, will go to your house. We will take a urine sample, you see? We will bring it to the lab, call the doctor, all right? When the pharmacy have the result of your urine, culture of the urine, we will collaborate with the hospice doctor, the hospice physician, and then he will in turn prescribe you an antibiotic, okay, that is good for the UTI, that is specifically going to target the kind of UTI you have. And then the hospice nurse, of course, will, teach your family members, will teach you as a caregiver how to, administer the medication. We will do some teaching regarding, the frequency, the dose, all right, the signs and symptoms to look out for. So therefore, your mom has a UTI and she doesn't have to go to the doctor's office. She doesn't have to go to the hospital, and it is handled right away, really quick. Even if it's a weekend, okay? Hospice nurses work on a weekend. Like for example, today is a Saturday. There are so many of hospice nurses out there working to make sure your loved ones is comfortable, okay? Talk to me, my hospice family, talk to me. Please like this video, share, okay? Give me a like, share this video. Give me a like, subscribe, please subscribe, okay? Help this channel to grow. Help this channel to grow, guys. So yes, so regarding addiction, just going back, I want to say that, okay, addiction is used when we want to escape. Addiction is most often used when we want to escape reality. You see, when we are seeking pleasure, when we are trying to forget about certain things in our life, you see, that's addiction. Whereas hospice, morphine, morphine is used to relieve your pain and suffering. You see, morphine is more like for the medical, emotional support. And not only that, it is well regulated by the hospice nurse. Okay? I'm just looking at my notes, guys. I'm looking at my notes to make sure that I touch base on everything. Okay? So let me know your thoughts. Let me know your thoughts. Let me know if you are a caregiver out there, watching. And please subscribe so that, and hit the notification bell so that you'll know next time I upload a video. Okay, because I'm about to go soon. But I just wanted to come out here and talk to us about addiction, talk to us about hospice, talk to us about morphine, and let us know that there is a big difference, okay? The chances of somebody being addicted to morphine while they are dying, while they're under, while they're at end of life, it's really slim to none. I have not, witnessed that, okay? I have not. All right? Okay? Any questions, my hospice family, before I let you go, before I go? Let me know if you have any question, and please subscribe to this channel, follow me, hit the notification bell so that you'll know each time I go live, okay? Because I'm going to try to go live very often, okay? I like to interact with you guys, all right? Okay? Okay? So I want to leave us with this. Next time you hear the word morphine, I want us to be comfortable. I don't want us to be scared. I want us to think about comfort. I want us to think about peace. I want us to think about dignity. You see, I want us to think about symptoms, relieving your symptoms, being comfortable. That's what morphine is for. Okay? So yes, my hospice family, like this video, subscribe. Let me know if you have any questions about morphine, okay? I would love to hear from you. If you are a caregiver, let me know if you have experience with taking care of a loved one who's dying. Let me know if you maybe have a friend, a neighbor who's currently taking care of a family member who is at end of life. And for those of you who don't know what hospice means that the doctor says that you have 6 months or less to live. Hospice means that the patient, okay, that your caregiver, that your family member has 6 months or less to live, and that the doctor has exhausted all of the medical treatments that he can, give, that he can do. And right now, the best thing to do is to go home and be at peace. You see, go home and be at peace with your loved ones, be at peace with your family, and also to focus on quality of life versus quantity of life. And that's where myself as a hospice nurse, along with a hospice social worker, we also have the hospice aide, we also have a hospice doctor, will come into your home and be a support to your caregivers, be a support to, you know, the person who's taking care of you, and making sure we guide you and we guide your family every single step of the way. Okay? So until next time, my beautiful, beautiful hospice family, take care of yourself and each other. All right? Take care.